The integrative medicine approach lets me look at the mind, the body, as well as the habits that somebody has in terms of how they might be affecting and causing a chronic illness or even acute illness that they might be dealing with. And we really aim to try to find the root cause to help with patients instead of just a top-down approach of just targeting symptoms and giving patients a medication. We really want to see if there's something underlying, even if it might not be something severe or serious or dire, something that just may need to be addressed so that we can make the patient feel a lot better and treat the condition for good instead of just putting a Band-Aid on it.
Okay, wonderful. So can you just give us a little bit more information about how you assess? I think most people understand body, but mind and spirit.
Absolutely. So for mind and spirit, I always have, first of all, my patients, both family medicine and integrative medicine, when I'm meeting them for the first time, have them fill out a complete integrative medicine history form for me. And one of the main questions is, what is your spirituality like? Do you believe in a particular spiritual guide? Does that influence you in any way? And just to see if they have some sort of grounding practices or mind-body approaches that they feel are very important to them, because I want to try to help whatever recommendations I give, I want to try to make sure that it takes those cultural and personal beliefs into consideration as well. And then as far as mind goes, we always say in family medicine that 75% of patients are actually coming in with an underlying mental health symptom, not necessarily a disorder, but maybe some sort of symptom. And the more you ask those deeper questions, then you find out really, okay, somebody's pelvic pain might be because they're dealing with some stress in the family, or they're dealing with relationship issues. Or they have overflow or bladder incontinence because they're so busy that they're actually not committing any time to go to the bathroom or even like feel and notice their body signals. So that's kind of how a huge part of mind-body influences. We always say in family medicine that 75% of patients are actually coming in with an underlying mental health symptom, not necessarily a disorder, but maybe some sort of symptom. And the more you ask those deeper questions, then you find out really, okay, somebody's pelvic pain might be because they're dealing with some stress in the family, or they're dealing with relationship issues, or they have overflow or bladder incontinence because they're so busy that they're actually not committing any time to go to the bathroom or even like feel and notice their body signals. So that's kind of how a huge part of mind-body influences influences disease or conditions.
Yeah, that's so wonderful that they're being screened at your level,
right.
At the beginning. That's so important. Women, it takes an average of 6 years for them to talk to their doctor, any doctor, even an OB-GYN, a doctor that focuses. It takes them 6 years to talk about what's going on down there. So when I teach the College of Medicine students, I get in front of the third-year OB-GYN students. I always say, if you don't ask, they don't tell. So, trying to get the conversation started, because it is an uncomfortable conversation to have.
Absolutely.
Yeah, the statistics for OAB or overactive bladder is 30% of women and 30% of men and 40% of women live with OAB. And that's just crazy. So that's basically your bladder leading your life.
Right.
So
and speaking of men in particular, I'm definitely trying to get better about asking men about it, because I've definitely had men that come and they haven't said anything, and then 2 years later they have a severe urinary tract infection and urine, kind of backed up into their kidneys, and their kidneys are swollen, and they need to get like a prostate reduction surgery right away. And it has happened multiple times that it's like we definitely need to bring that more to the forefront and make it okay to talk about.
Western medicine, we often think of more medication. So you go to the doctor, you get medication. Eastern medicine, maybe we think more of in the mind, body, spirit connection. And so integrative, and that was my point of the integrative, was how can we help you pick the best of both worlds? It's not necessarily an alternative, but it is a complement. We want to complement your healthcare with whatever works best for you based on your awareness. So that's what we really focus on at Motivate. That self-care is, not necessarily bubble baths and eating dark chocolate, but it's choosing what to do for yourself based on the awareness of how you feel now. So consistent, healthy awareness of the now, so that you can grow forward and be an empowered consumer of healthcare. Help us understand the Western medicine, the medications that are typically given for overactive.
Sure. Yeah. So I'll probably use brand names because I forget the other names here, but usually, Vesicare and Ditropan and Myrbetriq, they all work to kind of help with the kind of musculature of the bladder, so that you're not having as much of a stimulation to try to go to the bathroom without you being ready for it. Kind of helps with that overactive neurological signal that you're getting from the bladder. However, they always have a lot of side effects, a lot of dry mouth issues. They can cause constipation. Some of them can even cause like a mental status change. So they're even contraindicated when you're over 65 years of age, certain classes of medicine. So yeah, we have to be very careful. And then they can cause interactions. They can raise blood pressure. That's one of the most common side effects. And they can, make it such that other medications work a little bit differently. So we do have to be careful about that.
And let's now go into supplements, or is that the best way to say it? Dietary recommended, natural approaches.
Sure, whatever you want.
Yeah. I would say natural approaches. So, right, if nature made it, that is pretty much what we consider a natural approach. And so therapy is considered a natural approach because it is using your body. I've had people ask, how is therapy a natural approach? You really can't get much more natural, right? You're re-educating your body, changing up your habits, and then you change your life that way. So appreciating that change is constantly happening, right? So no matter what age you are, literally no matter what age you are, your hormones are still changing and shifting. So even post-menopause, ages and stages. So what both Dr. Treather and I think agree on is that we want everybody to, age through the stages with grace and ease. And so listening to things like this and talking and learning and being aware of your own personal habits and what changes are positive for you and what changes you need to learn more about. One of the handouts we give, we actually have a bunch of handouts based on the evidence-based research. We give natural dietary recommendations. We have little handouts like this. And this is for supplements for urinary tract dysfunction. And so we were going to kind of talk about what's on here. The first one is pumpkin seed oil or capsules. That is, from what I understand, is the main ingredient in Azo.
Exactly. The Go Less Azo version. Yes.
Is that something you can buy over the counter?
Yeah, that's something you can buy over the counter. I've had people try different varieties of pumpkin seed extract or pumpkin seed oil. There is a Doctor's Best has a pumpkin seed oil as well, 500 milligrams. I usually have people take it twice a day to get effectiveness, but you can go up as frequently as 3 times a day. And I would say like mixed reviews. Some people do find it's helping maybe, for about a month or two, and then afterwards, maybe not any improvement. Some people really haven't seen that much improvement. But I do have like maybe a third of the population that I've recommended and they thought it was great, and they don't have to even worry about it. Probably better for mild overactive bladder.
Okay, so urgency, frequency,
right.
Incomplete emptying, weak stream, frequency straining, right? So straining to pee is never normal.
Right.
So
yes,
it usually comes from feeling like you're not emptying. And then there's no side effects. from what I understand.
No,
Okay.
no side effects. Just make sure you're not allergic to pumpkin, but otherwise, yes, you're
Okay.
fine.
All right. And then sal palmetto, is that one?
Yeah, saw palmetto is a really good supplement. I have only recommended it to males though, for more of like a prostate induced, prostate enlargement induced urinary issues. Have you recommended it to females at all, or?
No, well, we have it on here for men, right?
Okay, yeah.
So,
Okay, yeah. So, yep. So that is great. Men love this supplement.
wonderful.
The one thing to tell you about anything we're trying to do in terms of shrinking the prostate, it's not going to happen overnight. Whether it's medications or supplements, it's going to take 3 to 6 months for this to work.
Okay.
So they just have to kind of stick with it. Yeah, they just have to stick with it. There's no drug interactions with saw palmetto or pumpkin seed for that matter. And I usually have people do the 160 milligram twice a day.
Okay.
Supplements in general, I know everybody wants to just be able to take it once a day, but because they're a little bit weaker, it's way more effective to take it twice a day at a lower dose than once a day at a higher dose.
Morning, night.
Exactly. Morning and night, or breakfast and dinner. Exactly.
This says
Yep.
best if it contains 80 to 90% of the volatile oil. Is
Yes.
that true? Okay.
Yeah, it will say that. A good supplement brand will say that on there, 80 to 90% of the saw repens or something like that on there, which is the volatile oil.
Is it Serenoa for pens?
Yeah, there we go. Sarah.
Yeah. Yep.
That works.
Yeah, so it's an extract / oil is how it's written on here. And then the possible side effects is mild GI.
Yeah, mild gastrointestinal symptoms. I have really never had a patient experience them, but it's always good to kind of just, start one thing at a time. If I'm especially recommending supplements, I usually recommend 3 or 4 at a time for various things when I see people, but I tell people to just start one at a time, leave about 4 to 7 days in between adding each new one. So if you get any type of reaction, whether it's gastrointestinal or rash or anything, you know exactly what caused it.
Yeah, right. Don't add a bunch of new things all at once. Don't try everything.
Exactly.
Even though it's what we want to do.
I know. We just want to all get better right away.
Yeah, we want to get better right now. So I'm glad that you mentioned that, especially for supplements. I do think it takes time. It's not that immediate relief. And that's also, so what we think of as more complementary types of things, therapy can be included in that. It's not an overnight, but I say the habits didn't happen overnight. So
exactly. Yeah.
Overnight either. And so the same can go for whether it's fascial, muscular habits over tension, when we're always sitting on, we're always rotated this way to talk to all of our patients, right? So my body
exactly.
And so it needs time to unlearn it. And the same can be said for how the body processes chemicals and enzymes and hormones and all of that too, right? And medications can it can affect that. So based on what other medications you're taking, can that affect how supplements interact?
Yeah, I would. Yeah. Well, it's kind of more, it can go either way. I mean, medications can make supplements get processed quicker through the body, or the other way around, where supplements can make medicines metabolize a lot quicker, and then the medicine is not as effective. So it is definitely important to at least let your doctor know, even if they're not well versed in medications and supplements. Please let your doctor know what else you're on. They might say to stop something, and they're not trying to just just go against what you want to do, but they'll want to make sure that you're not doing anything unsafe for yourself.
Keep you safe. Yeah. Right.
Yeah.
Okay, so we were just talking about the saw palmetto. So that's especially beneficial for men that have been diagnosed with BPH, benign prostate hypertrophy. And so basically what that is that if we look at the bladder, the prostate is wraps around at the base. And when it gets enlarged, it can put more pressure on the urethra and make it more difficult to go, or make you feel like you have to go more. But so I think urgency and incomplete emptying are the two big signs of that weak stream and what we call post-void dribbling. So, you go to put it away and walk away and you're still dribbling a little bit. So the drugs and the supplements, the main goal is to stop the growth of the prostate, correct?
Exactly. And to shrink it.
Okay, to stop it from growing and to reverse the process. And that's what the saw palmetto is showing to do.
Exactly.
Awesome. Yes. That's really cool.
It's an awesome supplement.
Yeah. Okay. I hear that, men out there.
Exactly.
Okay. And women who are going to be the ones
not their husbands.
Exactly. So, and it's something that they can take. Any of this stuff is something at the first sign of things that you know. So that's why I really promote know your normal. You know,
yes.
How often right now? How often when we ask people, how much are you drinking and how often are you peeing? And people are always like, oh, I never thought about that. So think about it now, and then you'll know if you know it's affecting you. Once it starts to affect your quality of life, let's get on it now. So they could start taking something like this.
Yeah, after it's been going on for at least a month or so. Yeah, because I mean, if it's initial, you want to make sure you don't have a UTI or prostatitis or epididymitis.
People go, I think, right? Is UTI right off the bat? They swear they have UTI. Yeah,
especially men. Yes, exactly.
Okay. Yeah. Right. So then, yes, we definitely always want to rule that out ASAP, right? Because that can cause a lot of problems. So, and that's easy enough to just go and get your analysis anywhere. You can, it's not something you have to schedule an appointment and all that. Usually you can just, they tell you to go to your nearest walk-in or something, right?
Yep. Or every doctor's a little different, but it's very, very easy to manage.
Yeah. Okay. So then going in from that, I think cranberry juice, right? Or cranberry capsules, that's a big one for people who have frequent UTIs or feelings of UTI, right? And so I think UTI, right? So that can be extreme pressure in the bladder, so right above your pubic bone, feeling that pressure, pain with urinary urge, pain with peeing, right? Maybe having some pink or blood in the urine.
Exactly. Yep. Yep. You might have some bladder pain, so what we call suprapubic pain, right in the lower pelvic region. Even not when you're going to the bathroom, just feels kind of uncomfortable, might spasm on you. And to clarify, if a man feels these symptoms, he needs to be seen by a doctor because it's unusual for men to get urinary tract infections just because of the anatomy. But women, their urethra is very close to the vagina and the anus, so there's contamination that can happen pretty easily. So women tend to know their bodies and tend to know when they got a UTI coming on. If it becomes much more severe, like you're having fevers or chills, or the pain is excruciating, or you're urinating frank blood, then you definitely need to be seen right away and not managed on the phone. Mm-hmm.
Okay. So can taking cranberry capsules be used as a preventative, whether you have UTIs or especially if you know that it could happen or has happened?
Exactly. Yeah, that's absolutely right. It can be used in two ways. It can actually be used as a preventative. So you can take either the juice, you can drink, a couple of ounces, 2 to 4 ounces, 1 to 2 times a day as a preventative. Just, mind that it does have quite a bit of sugar. So, and it's extremely tart. So it's hard to tolerate for some people. Otherwise, you can do the capsules, the 500 milligram capsules, 1 to 2 times a day. But I usually stick with 2 times a day if you're a frequent UTI person who gets UTIs. But the other way it can be used is that some people have success with just using it at a higher amount. So using maybe 1,000 milligrams of cranberry extract 2 or 3 times a day when they have UTI symptoms. So right at the beginning of that, starting to flush your body with tons and tons of water, which people don't want to do because it's actually a little bit painful, but really forcing yourself to drink plenty of water, more than the usual 64 ounces, every day during that urinary tract infection, if it's mild enough, and having the cranberry tablets at a higher amount or drinking the cranberry juice can actually flush the bacterial infection out if it's small enough. But if that's not working, then unfortunately, it's time to get an antibiotic.
So another reason to know your body, to know you're normal, so that you catch it.
Exactly.
Know it. Women know their body, right? So we always.
That's right.
And to do the same. Right.
That's exactly right.
And from what I understand, that it's an antiseptic. It's not antiseptic.
Exactly. It's a bit of an antiseptic in the sense that it, just kind of makes the bacteria. It renders them ineffective. So then it like neutralizes, I guess, an easier way to put it, neutralizes the bacteria, and then they don't replicate and form the infection. So that's kind of how it helps.
Awesome. Okay. And so just maybe some rashes or GI issues here for side effects as well.
Yes. Yeah. A little bit of GI issues, rashes, or, sugar. If you're drinking the juice, might get too much of sugar.
Okay. All right.
One other thing I should mention about cranberries.
Yeah.
Cranberry extract. So the only thing I would say is kind of a different topic, but people who have chronic bladder pain, the cranberry extract can actually be a little bit irritating. So if it's something called interstitial cystitis, so if you have that condition diagnosed by somebody, it's like a chronic bladder pain, just comes and goes without having an actual urinary tract infection. Cranberry and tart things and sour things and citric stuff. There's a bunch of foods can make that worse. So I would avoid that.
Right. Right. So that would be the reason if this continues to happen,
right.
You continue to feel that you have a UTI and that you're being told that you don't have a UTI, then you're
right.
going to start questioning, interstitial cystitis, and then start bringing that conversation to your doctor and see what kind of things you need to do.
Absolutely.
Yeah. So,
absolutely.
Beautiful. Thank you for bringing that up.
No problem.
All right. So D-mannose, that's another big one.
Yeah.
A lot of great things about.
I love D-mannose. I put a lot of my patients on it and have had excellent success. It helps to prevent the bacteria from attaching to the bladder wall. So then thereby preventing the, like flushing the bacteria out and preventing a reproducing bacterial infection in the bladder. It's usually 1,000 to 2,000 milligrams, and you do that once or twice a day. I pretty committedly have people taking at least 1,000 or 1,500 milligrams twice a day. If they're on it, it has to be at a high dose. They're usually sold in 500 milligram capsules, so I know it's quite a bit, but it works extremely well. And it's got minimal to no side effects, and maybe a little bit of loose stools, but not very much. I have not had anyone report that. There is also some pills that'll sell D-mannose with cranberry extract, which is kind of nice. So you can just take both of the, take it as a combined supplement, and it works extremely well to reduce the frequency of the UTIs, but it doesn't work in acute UTIs. Okay, so if you have an acute urinary tract infection, the D-mannose really won't do much for you.
Okay, so it's only to use if
as a preventative.
Okay, so no symptoms, you're just taking it because you know you have the issue.
Exactly, you're prone to them.
Okay, all right. So what other ones do you recommend that I don't have?
That's good. Those are actually the main ones I recommend. Okay. I do really like to promote probiotics. So probiotics are excellent for gut health and bladder health. You are going to be consuming the probiotic. You don't put it in your vagina, though some people do that. You just take a kind of general broad spectrum probiotic, which means it has at least 3 or more strains of bacteria in there. And if you're taking it as a supplement, and at least like 10 billion colonies of bacteria, and you just take one a day, preferably on an empty stomach in the morning. And you wonder, how is this going to help you? Because you're taking it through your gut. But there's actually something called the translational effect. And because the bowel sits on top of the bladder, and the uterus is there as well next to it, as the healthy bacteria get into the large intestine, they can move through the wall of the intestines and move through the wall of the bladder, and not really the bladder, because you want that is actually sterile, but move through the wall of the vagina and kind of help with improving the bacteria that are move through the uterus and help the bacteria that are kind of living in the vaginal wall as well, secondary to taking the probiotic orally.
Awesome. Yeah.
Kind of interesting.
Bladder, I say that the bladder wears a uterus hat. Okay? So bladder, uterus, and then we have the rectum that wraps.
There you go.
Like that. So, and then
exactly
on top is all of your many feet. So
yes, of intestines.
So they are connected. That's wonderful. Thank you. So yeah,
Absolutely.
probiotics. So yeah, that's wonderful as far as, yeah, that's something that we always talk about, but people do usually think about it for GI health, but
Right.
it has a wonderful bladder health effect too.
Exactly.
Right.
I don't recommend that people douche. I'm sure you also say the same. Because that will take all the good bacteria out of your vaginal canal, and then you'll be actually more susceptible to infections and yeast and things like that. So don't douche. For men's health, just for general prostate health, foods that are really good are especially foods that contain lycopene. So lycopene is found in red fruits and vegetables, so especially tomatoes. Huge source of lycopene, watermelon too, but not as much. It's just having more of that in your diet is very helpful for the prostate. Pomegranate is also really good for the prostate too. So if you wanted to do it in the form of juice, just like an ounce or two, once or twice a day, can be very helpful for prostate health. And then lastly, or second to last, green tea is very good for the prostate in general. It's very helpful to regulate hormones, both for men and women actually, and just drinking a cup or two of green tea per day, preferably not decaffeinated, because the caffeinated form actually has more of the antioxidants, so that can be beneficial for you. And then lastly, the cruciferous vegetables, so broccoli, cauliflower, those are all really great to help with cancer prevention for the prostate, and breasts too. I know we're not talking about that, but just in general, adding those foods to your diet, trying to get a serving or two per day, can be just so good for you. And really, you're just honoring your body. You don't have to think about it as a chore, more of thinking about it as what helps you stay well.
Right. Healing your temple or taking care of your temple.
Exactly.
One not forgetting in this life. So
that's right.
Right. And, be kind to it and you'll be kind to you. So
that's right.
Things like with tomatoes, that there can be some acidity that, right. So tomatoes, and then same thing, the green tea, caffeine can be a diuretic. So just being aware again of your normal, if you can do these things and it doesn't affect your symptoms negatively. But
absolutely. Yeah, absolutely. Good point.
Good. Those are wonderful. Okay. So eat whole foods. Eat your rainbow.
There you go.
Right, Doc?
That's right. Exactly. Not Skittles, though. I guess if you're just thinking about kind of lifestyle measures, more for like overactive bladder, if you are not someone who tends to exercise, just trying to work on your own core strength, especially before you are pregnant or while you're pregnant, working on your abdomen and your core back muscles can really help strengthen your pelvic floor as well. And obviously people like Denise are here to help you with that. Yes. not just your pelvic floor after it becomes a problem, but beforehand as well. Right. To strengthen your body. So that's really important. Working on, processed foods, of course, it's controversial. Are they really, how bad are they for your bladder? But in general, if you're someone who mostly is living on kind of fast food diet or processed food diet, lots of frozen canned foods and things like that, frozen vegetables are fine, but more like pre-prepared things. Trying to make sure you kind of dial back onto that, dial back on the sugar, and add some more whole foods into the diet can be really, really helpful. Some people will just even try an elimination of a particular food group if that's safe for them, like whether it's wheat or dairy, for a week or two, and see if it makes any difference in their overactive bladder symptoms or how frequent they have to urinate, or how prone they are to a UTI, and just kind of, trying different things here and there, whatever you feel comfortable with. Definitely, you can find a lot of things that, before you even come into a CS.
Right. Well, awesome. So just to dial back with core strength, it's also, one of the functions of the pelvic floor, other than sphinctering off, urine and stool, is a sub pump. There's a lymphatic function there, and that's where a lot of the issues with menopause and the dryness can happen. So just moving, whatever movement is that you enjoy. So whether it's walking or yoga or whatever, just moving your hips and improving your flexibility. So especially after menopause, after 45, I say we don't get flexibility for free anymore. So it's not just about strength, it's about length too. So having something that you enjoy movement wise also then is an approach for the mind, body, spirit. I think that's a nice overall finding. Self-care. It doesn't necessarily have to be that you're lifting weights and hitting the gym, whatever.
Yes.
Going for walks with your family, moving is really important. And when we're in pain or we fear leaving the house, we get stuck in that cycle that our world gets smaller. So yeah.
Yes, exactly. Yeah, for sure. I completely agree with you.
Yeah, thanks.
Try to be present more. I think that's a big part of it. People are not being present. I know, I don't blame them. It's just hard. This life is very hard. There's a lot of distractions and responsibilities, right. But and then by the time we see people, it's like, oh, I don't know how this happened, but actually it gradually had been going on for several years.
Yes.
So try to be present, as much as possible. And you can't be every minute of every day, but every day, if you can give yourself some time to do that, then you help heal yourself.
And then communicate what you find as you find it, right?
Exactly.
With the team of people you trust, and define the team of people that you trust.
That's right. Exactly.
Listening to you and helping you achieve your goals. But you have to know what your goals are.
That's right. Exactly. But the healthcare provider can help you set them too.
Awesome. Okay. Well, I can't even thank you enough for spending this amazing amount of time with me, helping me spread the word and get resources to people that maybe aren't able to, get out and about as much, that there is still a million ways to care for yourself. And there are people like you that are helping people take control, take their lives back. And I just love working with you and having access to you. So thank you so much.
Thank you. Thank you for this opportunity. I appreciate it. I appreciate you working with me and for us sharing patients. It's been a joy, and they always have best things to say about you and your team as well. So
awesome.
Go see Denise, guys. She's awesome. I'm going to come see you.
Awesome. Thank you so much.
Thank you. Take care.